In the previous lesson, we spent some time talking about the idea of retrograde amnesia, a type of memory loss that involves essentially the inability to recall memories from a past events, often as the result of some kind of traumatic injury or maybe some kind of degenerative illness. This lesson is going to talk about anterograde amnesia, which is the type of memory impairment that affects the ability of an individual to form new memories after the onset of a condition. While it might be the case that at the same time their long-term memories from before the event that takes place causing the amnesia in the first place may remain completely intact. This is part of the specification 2.1.3, which requires us to understand both retrograde and anterograde amnesia. Like I've just said, what we're going to do in this lesson is highlight what is cited here in blue, which is talking about the second of these types of amnesia. So essentially, the idea of this type of amnesia, anterograde amnesia, means that people with this kind of condition have difficulty learning new information or recalling things that have happened since the onset of their amnesia, but that memories from the past or memories from before their condition might be completely unaffected at all in terms of their ability to recall that information. Now, again, just like retrograde amnesia, anterograde amnesia is typically caused by damage to the brain structures involved in memory formation. So particularly things like parts of the brain such as the hippocampus and the surrounding areas in the medial temporal lobe. And it can occur as the result of brain injury, of course, a trauma or an accident such as a head injury that will be able to damage parts of the brain that is responsible for memory processing. Similarly, just like with retrograde amnesia, a stroke can disrupt blood flow to the hippocampus and other related areas, which would then be causing this kind of amnesia, this damage to these memory centers. Neurological diseases such as Alzheimer's disease might have a degenerative effect on the impairment of memory, such as and additionally to this, encephalitis is another example that might be an illustration of this kind of disease or kind of condition that might cause this kind of amnesia. And then additionally, just like with retrograde amnesia, there may be social or psychological factors. These are less common, but extreme stress or psychological factors or psychological trauma can cause sometimes the triggering of this type of amnesia. But this is typically related to a different kind of amnesia known as dissociative amnesia. But we also have drug use and alcohol use as well that can, if prolonged use for in certain circumstances, can lead to an amnesia, particularly if it causes damage to the brain. Symptoms of this type of amnesia is essentially the deficit in forming new memories, but its presentation might vary depending on the severity of the condition. So, firstly, we might suggest that an individual may not remember new facts, or new names, or new events, or new experiences if they were learned recently. If, for example, you were introduced to a person but forgot the person's name shortly after meeting them, then this might be evidence of a kind of anterograde amnesia. It could also just be evidence of somebody who has forgotten because you did not process that into your long-term memory. So if we go through these symptoms, I don't want people in the comments thinking that they have this type of amnesia, because of course these are often as the result of some kind of traumatic event, some kind of brain trauma, some kind of disease, for example. Additionally, short-term memory is often severely impacted when thinking about anterograde amnesia. While someone might remember things that happened a few minutes or hours ago, they might not be able to retain or recall that information later on in time. They might have difficulty remembering what they did earlier on in a day, for example, compared to what they're doing now, like a few hours later. A person might remember events and facts from the past, but they might not be able to recall anything that happened after the onset of their amnesia. This might be especially common with retrograde amnesia, where there's a loss of memories that occurred shortly before the onset, though it can still be it still can be seen and visible in cases of anterograde amnesia. There might be this a symptom of anterograde amnesia that concerns repetitive conversations or actions. Because of memory impairment, an individual might repeat conversations or might repeat their actions unaware that they have already engaged in them. Furthermore, a loss of episodic memory. Episodic memory is the ability to recall specific personal experiences, might often be affected. People may forget the details of their recent personal experiences, but may be able to retain general knowledge, okay? So, for example, they might forget that they attended a friend's wedding, but they would still remember perfectly well what a wedding is in the general sense, the idea of a wedding. There's also this idea of fragmented memory. While older memories before the amnesia began may remain, but they may be somewhat fragmented, with gaps in recall about events that happened immediately before the onset of the amnesia, unable to be filled in. And then finally, in some cases, individuals might find it hard and difficult to learn new skills, even if they repeat them and practice them repeatedly. However, procedural memory, which is the memory of how to perform tasks like walking or typing or playing an instrument, for example, is often less affected in thinking about anterograde amnesia. That's a type of memory that is often not majorly affected when compared to things like episodic memory or types of memory that involves the learning of new skills, for example. The learning of new information or old information, for example.